Today, we're talking about Gliadel Wafer, which is an implant used to treat certain types of brain tumors, such as malignant glioma. The wafer is made of Carmustine and polifeprosan 20. Carmustine is an alkylating agent that works by slowing or stopping the growth of cancer cells, while polifeprosan 20 helps control the release of Carmustine in the brain. This medication is implanted directly into the brain during surgery, where it slowly releases the medication to target the tumor. The dosage and timing of Gliadel Wafer will depend on your specific condition and should be determined by your healthcare provider. Be sure to follow their instructions carefully for the best results. After the surgery to remove a brain tumor, Gliadel Wafer is placed in the empty space to slowly dissolve and release medication in the brain. The number of wafers placed depends on the amount of space in the brain, with up to 8 wafers being placed at one time during surgery. The medication is designed to benefit patients by targeting the specific area of the brain affected by the tumor. It is important to follow the prescribed dosage and timing for the best possible outcome. Some common side effects of Gliadel Wafer may include nausea, vomiting, constipation, or abdominal/back pain. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. Serious side effects may also occur while using this medication, but you have been prescribed this drug because your doctor has determined that the benefit to you is greater than the risk of side effects. Your doctor will closely monitor you to decrease your risk. Contact your doctor immediately if you experience any serious side effects, such as swelling/redness/warmth or poor healing at the surgery site, signs of infection, fever, stiff neck, chest pain, mental/mood changes, depression, anxiety, or weakness. Seek immediate medical help if you experience very serious side effects like seizures or signs of increased pressure around the brain, severe headache, confusion, vision changes. Although rare, a very serious allergic reaction to this drug may occur. Get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed above, contact your doctor or pharmacist. If you are in the US, call your doctor for medical advice about side effects, or report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before using Gliadel Wafer, make sure to inform your doctor or pharmacist if you have any allergies or if you have a medical history. Also, let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products before having any surgery. If you are pregnant or planning to become pregnant, avoid using Gliadel Wafer as it may harm an unborn baby. Women should inquire about reliable forms of birth control for at least 6 months after the implant is placed, and men should do so for at least 3 months after the implant is placed. If you or your partner becomes pregnant, talk to your doctor immediately about the risks and benefits of this medication. It is unclear whether this medication passes into breast milk, so it's best to avoid breastfeeding for at least 7 days after the implant is placed. Be sure to consult your doctor before breastfeeding. When taking Gliadel Wafer, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's always best to keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure that you are using Gliadel Wafer safely and effectively. Always follow your doctor's instructions regarding the daily dosage and the optimal timing for taking this medication. If the Gliadel Wafer is accidentally swallowed, it can be harmful and may cause serious symptoms such as passing out or trouble breathing. In this case, it is important to seek immediate medical help by calling 911 or contacting a poison control center. U.S. residents can call their local poison control center at 1-800-222-1222, and Canada residents can call a provincial poison control center. During your treatment with Gliadel Wafer, you may need to undergo some lab or medical tests. It's important to attend all of these appointments to ensure the medication is working effectively for you. Gliadel Wafer is used to treat a certain type of brain cancer called malignant glioma. It is placed directly into the brain during surgery and slowly releases the medication over time. This helps to kill cancer cells and prevent them from growing back. The usual dosage is 1 or 2 wafers placed in the area where the tumor was removed. It is important to follow your doctor's instructions carefully. The optimal timing for taking Gliadel Wafer is during surgery to ensure it is placed directly into the tumor site. This product, Gliadel Wafer, is used in a hospital setting and is not meant to be stored at home. It is used to treat a certain type of brain cancer called glioblastoma multiforme. The wafer is placed in the brain during surgery to help slow down the growth of cancer cells. The daily dosage and optimal timing for this medication will be determined by your healthcare provider. It is important to follow their instructions carefully. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.